only 6 muscles you test in cerebral palsy in lower limb. So in hip, you test your iliopsoas, or mainly psoas muscles, either with a Thomas test or a Stahel test. You do your rectus femoris test by Duncan-Ely, and you do for your adductor test, and you do for Gastrosoleus the flap test, and we describe all these tests. There, how do you interpret these tests? All these things we have described in the clinical examination. In the knee, you do. So in the hip, you do for psoas, for rectus, for adductor, for Gastrosoleus, 4 muscles. And in the knee, you're doing for hamstrings and quadricep. So 6 muscles. And in the foot and ankle, you test the gastrocnemius by silver score test. So these are the tests you do mainly for describing a cerebral palsy. And then if they want detailed examination of foot, then sometime they may ask you to test for tibialis, anterior, posterior, and peroneal muscles, depending on where the deformity is that. They may ask you that. But these are the 6-7 muscles you have to test. Okay, so hip, knee, and foot and ankle we said, and then we also test for torsional deformity of the femur and tibia. And the femur we do for excessive anteversion, and you'll have to do prone test with what is the hip range of movements, and you do Craig test to see how the trochanter get prominent to assess your excessive anteversion. And for tibia, you do your thigh foot angle and intermalleolar axis assessments. And in the foot, you assess the deformity and few muscles if it is foot deformity they're talking about. So this is what you need to do in the examination.